Go ahead.
Good afternoon. I'm Tina Molay, the Chairman of the Board of Supervisors in Delaware County.
Cut. That was perfect. Let's do it one more time.
Okay.
And go ahead.
Good afternoon. I am Tina Molay, the Chairman of the Delaware County Board of Supervisors. An outbreak of respiratory illness due to a novel coronavirus, a disease known as COVID-19, is impacting more than 75 countries, including the United States, and currently there are more than 125,000 confirmed cases globally. Such epidemic conditions threaten or imperil the public health and safety of the citizens of Delaware County, New York. It is imperative to prepare for and respond to suspected or confirmed COVID-19 cases and to implement the measures necessary to mitigate the spread of this communicable disease in order to maintain the health and safety of the people of Delaware County and limit the spread of infection in our communities. There were so many things that we didn't know, the unknown. We had no idea what this would turn into. Doing that first video, letting Delaware County residents know, we didn't know. We just knew that we were going to have to shut down, that we were going to have to, close businesses, have people work from home. We really didn't know how to do it or what to expect. And now I would like to introduce Amanda Walsh, the Delaware County Public Health Director.
That day I thought to myself, this is actually happening, here we go, I think it's kind of surreal. We couldn't really anticipate how this was going to play out over this whole year, so it's been pretty eye-opening. Before that, actually, we had been quarantining travelers. We had started to do that in February, so we were already starting to kind of dip our feet in, but this was it, our first case. And kind of from that point on, my brain had to sort of focus on forward as to what we were going to do next, the next week, the next few weeks, how this was going to look, and constantly keeping the staffing that we had available. And you're constantly just trying to think on your feet as to how you're going to prepare for the next moment and what's coming.
We understand that the disruption of daily life is real and significant, but so are the potential life-saving benefits for everyone, especially our most vulnerable community members. Everyone has a part to play, and we're asking people to think about what they do in a typical week, how they would limit contact with others if asked, and how they could help people in their community who might need their support when social distancing measures are in place.
From that Saturday, when we did our first video declaring state of emergency, I called an emergency county board meeting on Monday. I met with my colleagues on the board. We set in motion a plan for me to meet with all of our department heads in the county, and that was on Tuesday that I met with the department heads. And we collaborated within 24 hours on how to close down our offices. The biggest important decision we had to make was, how do we continue business and keep our people safe, our county employees? We still have the same services that needed to be provided. At the same time, not knowing where this was headed, we had to come up with a plan to keep the services flowing and keeping our employees safe.
And then you had all of the communication with all of your partners. And initially, there was a huge amount of communication with our school districts. That was right around the time where the schools were trying to decide, when are we supposed to be closing? What are we supposed to do? We had meetings with school superintendents and, who had the authority to do what, how all of that was just starting to kind of flesh out. We started to see some executive orders. At the local level, you started to see some activity. And then things started to change. It was a tremendous amount of information, a tremendous amount of change in a very short amount of time. It was a lot. It was a lot to take in.
It was a hustle. It was trial and error. All the employees for the county, the department heads, everybody pitched in. It wasn't just one person just taking charge. We all worked together. The employees, they did a phenomenal job. We tried to accommodate the work that needed to be done, and it just all started to click together.
We were still working our regular hours, but then it soon became we were working until like 9, 10 o'clock at night. If you kept pulling lab reports down off of the system, you could probably have done it 24/7 until we came up with a system like, after this time during the day, you don't pull any more lab reports, they'll be there tomorrow. Like you just have to stop. Otherwise, you could just keep going and going and going. Everything was done by paper at that time as well. So that was logistically really tough.
The cases were starting to add up. We were starting to get an influx in people traveling up to our county, and we had a lot of the politics and things that were going on, with the fear, the anxiety. How are we going to do all of this? How are we going to get information to people appropriately? In general, when you have a brand new disease and there is not a lot of information initially available, it makes it very challenging when you're trying to make decisions. You're trying to work with state experts, the CDC, the WHO, and then rapidly you would have changes happening. The health departments in general have a good communication system. We have a mechanism to communicate related to communicable disease in general. The public health directors that are in my position, that you have doctors, you have, some people have epi backgrounds, some people have mental health backgrounds. Everyone brings a little piece of their expertise to the table, and then you have some really great state epi people that rapidly though became stretched very, very thin. So early on you realize that, okay, you're on your own for a bit. A lot of the system for how to manage cases and contacts really didn't get developed until later on in the process. So those first couple of months were very, very dicey, and there was just, like I said, a lot of activity.
Being that the county has been preparing for something like that for a number of years, and knowing Mandy and her staff, I really felt that if it turned out to be something big, we could certainly handle it. I had no doubts. The state took a way more proactive role than they generally do during disasters, so it changed things a little bit for us. So with them taking that proactive role and essentially telling the counties what they were going to do, we essentially turned into the logistical side as far as supplies, doling out those supplies, finding the supplies, deciding who gets what and how much of what they get, which was sometimes one of the most difficult things. The county essentially gave us free rein to make those purchases. We were able to find all sorts of alcohol-based cleaning supplies from a little shop over in Margaretville. 3 pallets of hand sanitizer from Mellencrot. Things would come at all hours of the day and night. If you requested something from the state, it could show up at 10 o'clock at night on a Friday night or 3 o'clock in the afternoon on a Wednesday. We worked pretty closely with the health department with their tracking of positive cases. We actually entered all the positive case addresses in our computer-aided dispatching system. So we were able to alert the first responders if they were actually going into, someplace that was COVID related. Even though it might not have been for a COVID case or COVID-based problem, we were still at least able to give them that heads up because a lot of people weren't very forthcoming with that information. The health department has been pandemic planning and pod planning. They've been drilling these plans. They've been exercising these plans every year for as long as I've been at the county. So it was a pretty big shock to everybody's system when all that went right out the window, right from the get-go. It was completely taken out of the county's hands. All that planning and everything just kind of went right down the tubes.
The governor had put together a control room, what they called it. And it really was, for our region, it was the 8 county executives or chairman of the boards. The hard part is how often they change the rules. The adapting to the daily changes for me, for our departments, was difficult because we would set up to do one thing, and then less than 24 hours later, we would have to change. We would have the call every day, 7 days a week at the same time. But when the governor couldn't make a decision or didn't have the resources to make the decision or even know how to proceed, our call would take place sometimes at 10 o'clock at night, which made it difficult on, our businesses that, everything was up in the air. So that was a difficult period. We're still doing the calls. We're not doing them 7 days a week, but we still are doing phone calls with the governor's office to try to keep everything coordinated and all on the same page.